Hello, future nurses. Welcome back to the channel that helps you conquer the NCLEX with confidence. We share high-yield NCLEX content every single day. So if you're aiming to pass and start your nursing career strong, you're in the right place. In today's video, we're diving into endocrine pharmacology, covering essential medications like insulins, antithyroid agents, corticosteroids, and hormone replacements. We'll go through 30 must-know NCLEX-style questions with clear explanations to help you understand and retain what really matters for the exam. So grab your notebook, stay till the end, and don't forget to follow us for daily NCLEX topics that get you one step closer to passing. Let's begin. Before we dive into today's question, let me ask, are you completely prepared for the NCLEX? If there's even a bit of hesitation, our Complete NCLEX Review online course has your back. You'll get access to 100 hours of animated content, 500 hours of in-depth lectures, 5,000 high-yield questions, 500 NGN-style case questions, and 15 mock exams designed to feel like the real thing. You'll also receive a comprehensive NCLEX eBook, all valid for 1 full year. Right now, you can grab it at 70% off for a limited time. Thousands of students are already on the path to success. And you can be too. Click the link in the description and get started. Let's dive into question number 1, which focuses on safe insulin administration for clients with type 2 diabetes mellitus. A nurse is conducting discharge education for a client with newly diagnosed type 2 diabetes mellitus who has been prescribed rapid-acting insulin, also called as Insulin lispro, as part of a basal bolus regimen. Which statement by the client indicates the most accurate understanding of the timing and administration of this medication to minimize glycemic risk? Now let's look at the options carefully. Option A. After opening the insulin vial, I'll make sure to dispose of it after 25 days, even if some insulin remains. Option B. I will inject this insulin 20 to 30 minutes before I start eating to give it enough time to start working. Option C. I'll make sure to inject the insulin while I'm eating or just before, so it matches my blood sugar rise during meals. Option D. Taking this insulin at bedtime will help me avoid those early morning high blood sugars I sometimes get. Take a moment to think about which response shows the most accurate understanding of how rapid-acting insulin works, especially when it comes to timing and minimizing hypoglycemia. The correct answer here is option C. I'll make sure to inject the insulin while I'm eating or just before, so it matches my blood sugar rise during meals. This response demonstrates appropriate understanding of how rapid-acting insulin functions, since it begins working in about 10 to 15 minutes. Timing the dose to coincide with food intake is critical to avoid hypoglycemia and ensure optimal blood sugar control. Let's move into question number 2, and this one focuses on an important safety consideration when giving metformin to a client with type 2 diabetes mellitus. A nurse is preparing to administer metformin to a client recently diagnosed with type 2 diabetes mellitus. To assess for potential complications associated with long-term metformin therapy, which of the following laboratory values should the nurse prioritize monitoring? Here are the options to consider. Option A. Liver transaminases, also known as alanine aminotransferase and aspartate aminotransferase. Option B. Serum potassium level. Option C. Vitamin B12 level. Option D. Hemoglobin A1C, also known as glycosylated hemoglobin. Think carefully about which lab value directly relates to a known side effect of long-term metformin use. The correct answer is option C. Vitamin B12 level. This is because metformin, which is a biguanide used to manage type 2 diabetes mellitus, can interfere with the absorption of vitamin B12 in the intestines, especially when taken over a long period. This deficiency may lead to megaloblastic anemia and neurologic issues such as tingling in the hands and feet, fatigue, or even memory problems. That's why clients on long-term metformin, especially older adults, should have their vitamin B12 levels checked periodically. Let's continue with question number 3. Which focuses on the safe pharmacologic management of hyperthyroidism in early pregnancy. A nurse is reviewing the plan of care for a newly pregnant client in her first trimester who has been diagnosed with newly confirmed hyperthyroidism. To ensure fetal safety, while effectively managing maternal symptoms, which pharmacologic agent should the nurse anticipate the primary healthcare provider will prescribe? Let's look at the available options. Option A. Liothyronine, which is triiodothyronine. Option B, iodine-131, which is radioactive iodine. Option C, propylthiouracil. Option D, methimazole. Think about which medication would be safest during the first trimester of pregnancy while still effectively managing maternal symptoms. The correct answer is option C, propylthiouracil. During the first trimester, propylthiouracil is the preferred antithyroid medication because it carries a lower risk of birth defects compared to methimazole. Although both medications cross the placenta, methimazole has been linked to serious congenital anomalies when taken during the early weeks of fetal organ development. After the first trimester, clients are usually transitioned to methimazole for long-term management due to its better liver safety profile. Quick pause before we jump into the question. Are you NCLEX ready? If not, the Complete NCLEX Review online course gives you everything you need. 100 hours of animations, 500 hours of recorded lectures, 5,000 top-rated questions, 500 NGN case-based items, and 15 CAT-style mock exams. It also comes with a detailed NCLEX eBook, all yours for an entire year. Limited time offer, get 70% off today. Thousands have passed. Now it's your turn. Visit our website using the link below. Let's tackle question number 4, where we assess how well a client understands their newly prescribed diabetes medication during an education session. A nurse is evaluating a client's understanding of newly prescribed Metformin for type 2 diabetes mellitus during a medication education session. Which of the following client statements demonstrates an accurate understanding of this therapy? Let's go through the answer choices. Option A. This medicine could lead to abdominal bloating or increased bowel movements. Option B. If I develop a headache, I should take over-the-counter acetaminophen and continue the metformin. Option C. I need to avoid all sources of calcium while on this medication. Option D. If I miss a dose, I should double up at the next meal to catch up. Think about which of these responses shows that the client truly understands both the common effects and safety precautions of taking metformin. The correct answer is option A. This medicine could lead to abdominal bloating or increased bowel movements. Gastrointestinal side effects such as bloating, diarrhea, and flatulence are well known and expected with metformin, especially when therapy is just starting. These symptoms are usually temporary and can often be managed by taking the medication with food or switching to an extended release form. Let's get into question number 5, which focuses on emergency fluid management for a client experiencing an adrenal crisis. A nurse is caring for a client admitted with signs of acute adrenal insufficiency, also called Addisonian crisis, including hypotension, fatigue, and altered mental status. The provider prescribes immediate fluid resuscitation. Which of the following intravenous fluids should the nurse anticipate administering to restore vascular volume and correct hyponatremia? Let's go through the options. Option A, 0.45% sodium chloride, also known as half-normal saline. Option B, 0.9% sodium chloride, commonly called normal saline. Option C, dextrose, 10% in water, often referred to as D10W. Option D, sterile water for injection. Consider which option best addresses both the need for restoring circulating volume and correcting low sodium levels. The correct answer is option B, 0.9% sodium chloride or normal saline. In an Addisonian crisis, there is a critical loss of aldosterone and cortisol, leading to severe sodium depletion and fluid loss. Isotonic saline is the ideal choice to rapidly restore vascular volume and correct hyponatremia, making it the first-line treatment during this life-threatening emergency. Let's tackle question number 6, and this one challenges your clinical judgment when it comes to spotting a prescription that doesn't quite add up with the patient's condition. The nurse is assessing recent prescriptions for a group of assigned patients. Which of the following medication prescriptions should prompt the nurse to question the provider due to a mismatch between the drug's therapeutic indication and the client's medical condition? Take a look at the options. Option A, calcitonin salmon for a client with osteoporosis secondary to long-term corticosteroid use. Option B, methimazole for a client with newly diagnosed Graves' disease. Option C, hydrocortisone for a client with diabetes insipidus. Option D, phenoxybenzamine for a client with pheochromocytoma awaiting surgery. Think carefully about which of these options doesn't match standard treatment guidelines. The correct answer is option C, hydrocortisone for a client with diabetes insipidus. Hydrocortisone is a synthetic glucocorticoid used for adrenal insufficiency, not for treating diabetes insipidus. In cases of central diabetes insipidus, the body lacks antidiuretic hormone, so the proper treatment is desmopressin acetate, a synthetic version of that hormone. Giving hydrocortisone in this context won't correct the fluid imbalance and might worsen blood sugar or electrolyte issues. Here comes question number 7, and this one's all about medication safety. Specifically, spotting a dangerous drug interaction that could easily be overlooked. A nurse is reviewing newly prescribed medications for a client who has recently started oral prednisone for an autoimmune condition. Which of the following concurrent medications, if prescribed, should prompt the nurse to question the order due to the potential for a serious adverse effect? Let's review the options. Option A, allopurinol. Option B, naproxen. Option C, pantoprazole. Option D, acetaminophen. Now, think about which of these combinations could potentially lead to harmful consequences when taken with prednisone. The correct answer is option B, naproxen. Naproxen is a non-steroidal anti-inflammatory drug, and when it's used alongside systemic corticosteroids like prednisone, there's a significantly increased risk of gastrointestinal complications, like ulcers, gastritis, and even gastrointestinal bleeding. Both medications independently weaken the protective lining of the stomach and interfere with prostaglandin production, which normally helps defend the gastric mucosa. This combination can be especially dangerous in older adults or those with a history of peptic ulcers. In such cases, acetaminophen would be a much safer option, or the prescriber should consider adding a proton pump inhibitor to reduce the risk of gastric injury. Let's take on question number 8. Which dives into client education and medication safety for those prescribed antithyroid drugs, specifically propylthiouracil. A nurse is providing discharge instructions to a client newly prescribed propylthiouracil for the treatment of hyperthyroidism. Which of the following client statements demonstrates an appropriate understanding of important safety considerations while taking this medication? Here are the options. Option A, I'll monitor for a sore throat or fever and report them immediately to my provider. Option B. This medication may initially cause some water retention and facial puffiness. Option C. This medication requires regular monitoring of my liver enzymes. Option D. I should expect my appetite and weight to continue decreasing as my thyroid improves. Think about which of these reflects a key safety concern unique to propylthiouracil. The correct answer is option C. This medication requires regular monitoring of my liver enzymes. Propylthiouracil is known to carry a risk of serious liver toxicity, including acute liver failure, so it is essential that clients have regular liver function tests, such as alanine aminotransferase, aspartate aminotransferase, and bilirubin, while on therapy. Educating clients to watch for signs like jaundice, dark urine, or pain in the upper right side of the abdomen is also important in early detection of hepatic injury. Let's break down question number 9, which highlights a key teaching point about insulin timing, crucial for preventing hypoglycemia in clients with type 2 diabetes mellitus. The nurse is providing discharge education to a client with type 2 diabetes mellitus who has been prescribed insulin aspart for postprandial glycemic control. Which instruction should the nurse emphasize regarding the appropriate timing of insulin aspart administration to ensure optimal therapeutic action and minimize hypoglycemia risk? Let's go through the options. Option A. Inject this insulin immediately after finishing your meal to prevent your blood sugar from dropping too quickly. Option B. This insulin should be taken at the same time each day, regardless of meals. Option C. Administer the insulin approximately 15 to 20 minutes before starting your meal. Option D. You should inject this insulin within 5 to 10 minutes before eating or while you're actively eating. Now consider which instruction best matches the pharmacokinetics of insulin aspart and ensures safety and effectiveness. The correct answer is option D. You should inject this insulin within 5 to 10 minutes before eating or while you are actively eating. Insulin aspart is a rapid-acting insulin analog that starts working within 10 to 15 minutes, peaks around 1 hour, and lasts about 3 to 5 hours. It's specifically designed to act quickly in response to food intake, so giving it right before or during a meal helps match the insulin's effect to the blood sugar rise. administering it too early, too late, or at a fixed time, regardless of meals, can lead to serious glycemic imbalances. Let's move on to question number 10, which focuses on one of the most critical aspects of diabetes management: timing insulin administration to match the body's natural glucose response after meals. A nurse is educating a client newly prescribed insulin lispro for postprandial glycemic control. Which instruction should the nurse emphasize regarding the optimal timing of lispro administration to achieve effective glucose regulation while minimizing the risk of hypoglycemia? Here are the options. Option A. You should inject this insulin 45 minutes before meals to give it enough time to work. Option B. This insulin works best when taken 1 hour after your meal to lower your peak glucose. Option C. It's important to inject this insulin 20 to 30 minutes before eating, just like regular insulin. Option D. Administer the insulin 5 to 15 minutes before eating or while you are actively eating. Now think about which response best aligns with the rapid onset and purpose of insulin lispro. The correct answer is Option D. Administer the insulin 5 to 15 minutes before eating or while you are actively eating. Insulin lispro is a rapid-acting insulin analog that begins working within 10 to 15 minutes, peaks in about an hour, and lasts around 3 to 5 hours. Its action is designed to closely mimic the body's natural insulin surge in response to eating. Administering it right before or during a meal ensures that the insulin is active when the glucose from the food begins to enter the bloodstream. So giving it too early or too late throws off this balance and increases the risk of hypoglycemia or post-meal hyperglycemia. Hold up. Are you feeling confident about the NCLEX? If not, you'll want to check out the Complete NCLEX Review online course. It's packed with 100 hours of animated videos, 500 hours of deep content, 5,000 practice questions, 500 NGN-style cases, and 15 full mock exams. There's also a full NCLEX eBook included with a 1-year access window. And right now, it's available for 70% off, but only for a short time. Click the link in the description and join the thousands of students who've already passed. Let's look at question number 11, which focuses on safe medication administration for oral anti-diabetic therapy, specifically Glipizide. A nurse is reinforcing medication teaching for a client newly prescribed Glipizide for the management of type 2 diabetes mellitus. Which of the following client statements indicates a correct understanding of how to take this medication safely? Let's review the choices. Option A. This medicine needs to be taken 30 minutes prior to meals. Option B. I can skip my dose on days when I feel like my blood sugar is well controlled. Option C. This medication must be injected at the same time each day. Option D. If I feel dizzy after taking this, I should double my next dose. Think about which statement shows the most accurate understanding of how this medication should be used in real life. The correct answer is Option A. This medicine needs to be taken 30 minutes prior to meals. Glipizide is a sulfonylurea, an oral medication that stimulates the pancreas to release insulin regardless of the current blood glucose level. Because of this, taking Glipizide without eating can lead to significant hypoglycemia. That's why it should always be taken about 30 minutes before a meal, especially breakfast. Timing helps improve absorption and ensures that insulin is available when food enters the bloodstream, minimizing the risk of low blood sugar. Now let's focus on question number 12, which highlights the importance of understanding insulin pharmacodynamics to prevent and manage hypoglycemia effectively. A nurse administers 5 units of regular insulin and 10 units of neutral protamine, Hagedorn insulin subcutaneously to a client with type 2 diabetes mellitus. In planning ongoing monitoring, at what time interval should the nurse prioritize assessment for hypoglycemia based on the pharmacodynamic profile of these medications? Consider the following choices. Option A, within the first 60 minutes post-injection, as the risk is highest during initial absorption. Option B, between 2 and 4 hours after administration, when the peak effect of regular insulin occurs. Option C, between 6 and 8 hours post-injection, when long-acting insulin analogs typically peak. Option D, between 12 and 24 hours after administration, when basal insulin reaches steady state. Now think carefully about which insulin peaks first and when the greatest hypoglycemia risk occurs. The correct answer is option B, between 2 and 4 hours after administration, when the peak effect of regular insulin occurs. Regular insulin has an onset of action within 30 to 60 minutes, peaks between 2 and 4 hours, and lasts about 6 to 8 hours. Neutral protamine Hagedorn insulin, which is intermediate acting, peaks later, typically between 4 and 12 hours. Because regular insulin peaks first, this is the critical window for the nurse to monitor for signs of hypoglycemia such as shakiness, confusion, sweating, rapid heart rate, or weakness. Early recognition and intervention during this peak period can prevent severe complications. Let's explore question number 13, which tests your understanding of preoperative medication management for clients with Graves' disease preparing for thyroid surgery. A nurse is preparing to administer potassium iodide, also known as Lugol's solution, to a client with Graves' disease who is scheduled for a thyroidectomy in 7 days. What is the primary therapeutic intent of this preoperative prescription? Option A, suppress the client's immune response to reduce risk of postoperative thyroid storm. Option B, prevent recurrent laryngeal nerve injury by stabilizing thyroid hormone levels. Option C, reduce the vascularity and size of the thyroid gland to minimize intraoperative bleeding. Option D, enhance calcium retention to prevent postoperative hypocalcemia. Take a moment to consider which outcome Lugol's solution is specifically intended to achieve before surgery. The correct answer is option C, reduce the vascularity and size of the thyroid gland to minimize intraoperative bleeding. When given in high doses, potassium iodide has a paradoxical inhibitory effect on thyroid hormone synthesis and release, known as the Wolff-Chaikoff effect. More importantly, in the surgical context, it significantly reduces the size and vascularity of the thyroid gland, which helps minimize bleeding and makes the surgery safer and more controlled. This effect typically begins within 24 to 48 hours and is most effective when used for about 7 to 10 days before the thyroidectomy. Let's move forward with question number 14, which focuses on client education for safe and effective corticosteroid therapy. A nurse is providing medication education to a client who has been prescribed oral prednisolone for a chronic inflammatory condition. Which of the following instructions should the nurse include to promote safety and therapeutic efficacy of this corticosteroid therapy? Let's review the options. Option A, this medication should be taken in the morning along with a meal. Option B, it's best to take this medication in the late afternoon to match your energy level. Option C, you should take this medication before bed so it works overnight. Option D, take this medication on an empty stomach to enhance absorption. Think about which option supports both the pharmacologic action and the safety profile of corticosteroids. The correct answer is option A. This medication should be taken in the morning along with a meal. Prednisolone is a systemic glucocorticoid, and taking it in the morning aligns with the body's natural cortisol rhythm, helping to reduce suppression of the hypothalamic pituitary adrenal axis. It also helps minimize side effects like insomnia. Taking it with food is essential to prevent gastrointestinal irritation and reduce the risk of ulcers, which are common with corticosteroid use. This timing and method of administration promote the safest and most effective therapeutic outcome. Let's break down question number 15, which focuses on calculating a weight-based intravenous insulin dose, an essential skill in critical care settings. The nurse is preparing to administer a regular insulin intravenous bolus to a client. The primary healthcare provider has prescribed an initial bolus dose of 0.1 unit per kilogram. The client weighs 242 pounds. How much regular insulin should the nurse administer to the client as an intravenous bolus? Here are the options. Option A, 8 units. Option B, 13 units. Option C, 11 units. Option D, 15 units. Now let's work through the math to find the correct dose. First, convert the client's weight from pounds to kilograms. 242 divided by 2.2 equals 110 kilograms. Now multiply that weight by the ordered dose. 0.1 unit per kilogram times 110 kilograms equals 11 units. The correct answer is option C, 11 units. This calculation ensures the client receives an accurate weight-based dose of regular insulin. Remember, Regular insulin is the only type of insulin approved for intravenous use and is commonly used in conditions like diabetic ketoacidosis. Because insulin also lowers potassium levels, nurses must monitor serum potassium and follow institutional protocols when administering this high-alert medication. Before we begin, here's a quick question. How ready are you for the NCLEX? If you need a complete prep system, we've got it. 100 hours of animations, 500 hours of lectures, 5,000 NCLEX questions, 500 NGN scenarios, and 15 exam simulations, plus a powerful eBook. You get all this for a whole year. Best part? You can enroll now for 70% off. Limited time only. Head to the link in the description and let your NCLEX journey begin. Let's go into question number 16, which focuses on evidence-based pharmacologic management for early diabetic kidney disease. The nurse is caring for a client recently diagnosed with early-stage diabetic nephropathy, as evidenced by persistent albuminuria and declining estimated glomerular filtration rate. The nurse anticipates a prescription for which of the following medications to delay disease progression and protect renal function? Consider the following options. Option A, vancomycin. Option B, enalapril. Option C, calcium carbonate. Option D, furosemide. Think carefully about which medication is not only safe for the kidneys, but also has protective benefits in the setting of diabetic nephropathy. The correct answer is option B, enalapril. Enalapril is an angiotensin-converting enzyme inhibitor that helps slow the progression of diabetic nephropathy by reducing glomerular pressure and proteinuria through vasodilation. It protects the kidneys by improving renal hemodynamics and reducing the damage caused by chronic hyperglycemia, even in clients who are not hypertensive. Regular monitoring of kidney function and potassium is essential when using angiotensin-converting enzyme inhibitors, but they remain a cornerstone in managing early diabetic kidney disease. Let's take on question number 17, which focuses on safe insulin storage, something every client with type 1 diabetes mellitus needs to understand clearly to maintain medication effectiveness. The nurse is teaching a client recently diagnosed with type 1 diabetes mellitus about proper insulin storage techniques. Which client statement indicates a correct understanding of how to store insulin safely to maintain its potency and therapeutic effectiveness? Let's review the options. Option A, I can store my opened insulin pen in the refrigerator and use it for up to 90 days. Option B, I should freeze my insulin if I'm not using it for a while to make it last longer. Option C, during travel, I can store my insulin in the glove compartment of my car. Option D, insulin vials that haven't been opened should be stored in the fridge. Now, consider which of these statements reflects safe handling and storage of a temperature-sensitive medication like insulin. The correct answer is option D. Insulin vials that haven't been opened should be stored in the fridge. Unopened insulin should always be refrigerated between 36 degrees Fahrenheit and 46 degrees Fahrenheit or 2 degrees Celsius to 8 degrees Celsius to preserve its chemical structure and potency. Once opened, insulin can usually be kept at room temperature for up to 28 to 30 days, depending on the manufacturer, but it should never be frozen or exposed to high temperatures. Proper storage is critical to ensuring consistent blood sugar control and preventing insulin degradation. Let's go into question number 18, which centers on insulin pump therapy, a modern and effective approach to managing type 1 diabetes mellitus. The nurse is educating a client with type 1 diabetes mellitus who has recently started using a continuous subcutaneous insulin infusion pump. The nurse explains that which type of insulin is most commonly used in insulin pump therapy to provide precise glycemic control. Here are the options. Option A, rapid-acting insulin. Option B, ultra-long-acting insulin. Option C, intermediate-acting insulin. Option D, long-acting insulin. Think about which insulin type has the flexibility and quick action needed for the dynamic dosing a pump provides. The correct answer is option A, rapid-acting insulin. Insulin pumps are designed to deliver small, continuous amounts of basal insulin throughout the day and allow the user to deliver bolus doses as needed before meals or to correct high blood sugar. Rapid-acting insulins, such as insulin lispro, aspart, or glulisine, are ideal for this purpose due to their fast onset of action within 10 to 15 minutes. These insulins closely replicate the body's normal insulin response and provide the precision needed for tight glucose control in pump therapy. Let's take a closer look at question number 19, which tests your understanding of therapeutic monitoring in clients receiving treatment for syndrome of inappropriate antidiuretic hormone secretion. The nurse is monitoring laboratory findings for a client being treated with tolvaptan for syndrome of inappropriate antidiuretic hormone secretion. Which of the following values indicates a therapeutic response to the prescribed medication? Let's go through the options. Option A, serum potassium 3.4 milliequivalents per liter. Option B, urine-specific gravity 1.01. Option C, hemoglobin A1C 5.8%. Option D, serum magnesium 1.7 milligrams per deciliter. Now think about which value directly reflects the action of tolvaptan and its effectiveness in correcting fluid imbalance. The correct answer is option B, urine-specific gravity 1.01. Tolvaptan is a vasopressin V2 receptor antagonist that helps correct the fluid retention seen in syndrome of inappropriate antidiuretic hormone secretion by promoting the excretion of free water. This process is called aquaresis. A urine-specific gravity moving toward normal, around 1.010, indicates that previously concentrated urine is becoming more dilute, which is a key therapeutic goal in treating this condition. This change signals that the medication is successfully reducing the antidiuretic hormone effect and helping restore fluid and electrolyte balance. Let's move on to question number 20, which highlights a critical aspect of endocrine management following adrenal gland surgery. The nurse is planning post-operative care for a client who has just undergone a bilateral adrenalectomy for treatment of Cushing's disease. The nurse should anticipate a prescription for which of the following medications to prevent life-threatening endocrine complications? Consider the options. Option A, levothyroxine. Option B, hydrocortisone. Option C, metformin. Option D, fludrocortisone. Think about which medication is essential to replace the hormones lost after both adrenal glands have been removed. The correct answer is option B, hydrocortisone. Hydrocortisone is a systemic corticosteroid that serves as immediate glucocorticoid replacement after bilateral adrenalectomy. Since the adrenal glands produce essential hormones like cortisol and aldosterone, their removal leads to an abrupt and complete adrenal insufficiency. Without cortisol, the client is at high risk for adrenal crisis, marked by low blood pressure, low blood sodium, high blood potassium, low blood glucose, and potential cardiovascular collapse. Administering hydrocortisone after surgery helps maintain hemodynamic stability and supports the body's stress response. This medication becomes a lifelong necessity for clients who no longer produce their own glucocorticoids. Just before we jump in, are you prepared to crush the NCLEX? If not, you need this: the Complete NCLEX Review Online Course. It has 100 hours of animation, 500 lecture hours, 5,000 practice questions, 500 NGN case items, and 15 realistic mock exams. With a full eBook included, get it now at 70% off, but only for a limited time. Thousands have already passed. Check the description for the website link and start now. Let's now examine question number 21, which focuses on recognizing serious adverse effects associated with antithyroid therapy. The nurse is interviewing a client who has been prescribed methimazole for the treatment of hyperthyroidism. Which of the following assessment findings requires immediate notification to the primary healthcare provider? Let's review the options. Option A, increased appetite. Option B, sore throat. Option C, mild hand tremor. Option D, menstrual irregularity. Now consider which symptom may indicate a life-threatening complication of this medication. The correct answer is option B, sore throat. Methimazole can cause a granulocytosis, a dangerous drop in white blood cells that increases susceptibility to infection. A sore throat is often an early sign and may be accompanied by fever or general malaise. Because a granulocytosis can develop suddenly and progress rapidly, any signs of infection must be reported immediately. The primary healthcare provider will likely order a complete blood count with differential to check for a severely decreased absolute neutrophil count, Prompt recognition and discontinuation of the drug are crucial to prevent severe complications. Let's go over question number 22, which challenges your ability to identify a medication that may be unsafe based on a client's specific endocrine disorder. The nurse is reviewing newly prescribed medications for a group of assigned clients with endocrine disorders. Which of the following prescriptions should the nurse question before administration? Here are the options. Option A, octreotide for a client with acromegaly. Option B, hydrochlorothiazide for a client with primary hyperparathyroidism. Option C, metformin for a client with polycystic ovary syndrome. Option D, desmopressin for a client with von Willebrand disease. Think critically about which drug may worsen a client's underlying condition due to its pharmacologic action. The correct answer is option B, hydrochlorothiazide for a client with primary hyperparathyroidism. Hydrochlorothiazide is a thiazide diuretic that increases calcium reabsorption in the kidneys, which can further elevate serum calcium levels in a client already experiencing hypercalcemia due to excessive parathyroid hormone. This medication is contraindicated in primary hyperparathyroidism and should be questioned immediately. Safer alternatives include loop diuretics, like furosemide, which promote calcium excretion and help manage hypercalcemia. Let's go through question number 23, which focuses on safe use and client understanding of a non-insulin injectable used in type 2 diabetes mellitus. The nurse is educating a client with type 2 diabetes mellitus who is scheduled to begin weekly dulaglutide injections. Which of the following statements made by the client would require follow-up by the nurse? Here are the options. Option A, I should tell my provider if I start having severe abdominal pain or persistent nausea. Option B, I should take this medication within 1 hour of eating a meal. Option C, this medication may help me lose some weight over time. Option D, I understand this medication is not a form of insulin. Now consider which of these statements shows a misunderstanding of how dulaglutide works and when it should be taken. The correct answer is option B, I should take this medication within 1 hour of eating a meal. Dulaglutide is a long-acting glucagon-like peptide, one receptor agonist that is administered once weekly. Its action is not tied to food intake timing, and it does not need to be taken before or after meals. This misconception may lead the client to incorrectly delay or skip doses, thinking it functions like short-acting medications or insulin. Follow-up education is needed to clarify that dulaglutide works continuously throughout the week, regardless of meal timing. Let's dive into question number 24, which tests your knowledge of drug classifications and their primary indications. The nurse is reviewing the medication list for a client who has been prescribed Sitagliptin. The nurse understands that this medication is primarily used to treat which of the following conditions? Take a look at the options. Option A, chronic obstructive pulmonary disease. Option B, diabetes mellitus type 2. Option C, osteoarthritis. Option D, hypogonadism. Now think about which condition sitagliptin directly targets as part of its therapeutic action. The correct answer is option B, diabetes mellitus type 2. Sitagliptin is an oral anti-diabetic agent that belongs to the class of dipeptidyl peptidase 4 inhibitors. It helps manage blood glucose levels by increasing incretin hormones, which in turn stimulate insulin release in response to meals and suppress glucagon secretion. This leads to improved postprandial glucose control with minimal risk of hypoglycemia. It is often used alone or in combination with other medications like metformin and is particularly useful in clients who are overweight or prone to low blood sugar. Let's move on to question number 25, which emphasizes monitoring for adverse effects following a dosage adjustment of thyroid hormone therapy. The nurse is caring for a client with hypothyroidism who recently had an increase in their prescribed levothyroxine dosage. Which of the following assessments is the nurse's priority in evaluating for potential adverse effects? Consider the following options. Option A, electrocardiogram rhythm strip. Option B, heart rate. Option C, bowel sounds. Option D, skin turgor. Now think about which of these would give the earliest and most direct indication that the increased levothyroxine dose might be causing complications. The correct answer is option B, heart rate. Levothyroxine is a synthetic thyroid hormone, and increasing the dose can lead to signs of iatrogenic hyperthyroidism, such as elevated heart rate, palpitations, and even atrial fibrillation, especially in clients with underlying heart disease. Monitoring heart rate closely helps detect early signs of thyroid hormone excess and allows for timely intervention before more serious cardiac effects occur. Pause for a second. Let's talk about your NCLEX prep. If you're looking for the most complete guide out there, this is it. 100 hours of animated NCLEX content, 500 hours of teaching, 5,000 high-yield questions, 500 NGN-style cases, and 15 exam-style mocks. Plus, you get a bonus NCLEX eBook and access for 1 full year. Get 70% off today. Limited time deal. The link's in the description. Join the thousands who are already passing. Let's continue with question number 26, which focuses on identifying a serious adverse effect related to an oral anti-diabetic medication. The nurse is assessing a client who is prescribed Sitagliptin for type 2 diabetes mellitus. Which of the following findings, if reported by the client, should prompt the nurse to notify the healthcare provider immediately? Let's examine the options. Option A, mild sore throat. Option B, abdominal pain radiating to the back. Option C, fatigue after meals. Option D, occasional sneezing and nasal discharge. Now think about which symptom could signal a dangerous complication of this medication. The correct answer is option B, abdominal pain radiating to the back. This symptom is a classic red flag for acute pancreatitis, a rare but potentially life-threatening side effect of Sitagliptin, a dipeptidyl peptidase 4 inhibitor. Pancreatitis can also present with nausea, vomiting, or a decrease in appetite, and if not recognized early, may result in severe complications. Any report of abdominal pain that radiates to the back should be treated as an urgent concern and reported to the healthcare provider immediately for evaluation and possible discontinuation of the medication. Let's go over question number 27, which focuses on safe insulin administration practices, especially when it comes to intermediate-acting formulations like neutral protamine Hagedorn insulin. The nurse observes a newly hired registered nurse preparing to administer neutral protamine Hagedorn insulin to a hospitalized client. Which action by the newly hired nurse requires the supervising nurse to intervene? Here are the options. Option A, gently rolls the insulin vial between the palms before withdrawing the dose. Option B, selects the upper outer arm for subcutaneous injection. Option C, draws up neutral protamine Hagedorn insulin into the syringe after regular insulin when mixing. Option D, vigorously shakes the neutral protamine Hagedorn insulin vial to mix the suspension before administration. Now think about which action could compromise medication safety or effectiveness. The correct answer is option D, vigorously shakes the neutral protamine Hagedorn insulin vial to mix the suspension before administration. This action can create foam and air bubbles, leading to inaccurate dosing and altered absorption. A neutral protamine Hagedorn insulin is a cloudy suspension that must be gently rolled between the palms to evenly resuspend the insulin particles without damaging the protein structure. Any vigorous shaking can compromise its potency and put the client at risk for poor glycemic control. This is a teaching moment where the supervising nurse must step in and provide immediate guidance. Let's review question number 28, which highlights the importance of monitoring for serious complications related to antidiuretic hormone therapy. The nurse is caring for a client recently prescribed Desmopressin for central diabetes insipidus. Which of the following laboratory values is most essential for the nurse to monitor to prevent serious complications of therapy? Consider the following options. Option A, serum sodium level. Option B, serum creatinine level. Option C, hemoglobin A1C. Option D, white blood cell count. Now think about which lab value would directly reflect a potentially life-threatening side effect of Desmopressin. The correct answer is option A, serum sodium level. Desmopressin is a synthetic analog of antidiuretic hormone that helps reduce urine output by promoting water reabsorption in the kidneys. However, if fluid intake is not properly restricted, it can lead to dilutional hyponatremia, dangerously low sodium levels. This condition may result in confusion, seizures, and even cerebral edema. That's why monitoring serum sodium is the most essential lab assessment when managing a client on Desmopressin therapy. Before we get started, let me ask, what's your NCLEX plan? If you don't have one yet, we've got you covered. The Complete NCLEX Review Course includes 100 animated hours, 500 hours of deep lecture content, 5,000 exam questions, 500 NGN case questions, and 15 full-length mock tests. Also included, a 1-year eBook guide. And yes, it's 70% off right now. But hurry, this offer won't last long. Click the link in the description and enroll today. Let's look at question number 29, which focuses on medication safety surrounding diagnostic imaging with contrast agents. The nurse is caring for a client scheduled to undergo a computed tomography scan with iodinated contrast. Which of the following prescribed medications should the nurse plan to hold after the procedure to prevent a serious adverse effect? Here are the options. Option A, amlodipine. Option B, metformin. Option C, levothyroxine. Option D, atorvastatin. Now think about which of these medications, when combined with contrast dye, could lead to a dangerous complication if not managed properly. The correct answer is option B, metformin. Metformin is an oral anti-diabetic agent commonly used in type 2 diabetes mellitus, and it is associated with a rare but potentially fatal complication called lactic acidosis, when renal function becomes impaired. Iodinated contrast can cause contrast-induced nephropathy, which reduces kidney function and may lead to the accumulation of metformin. That's why it is essential to hold metformin for 48 hours after contrast administration and resume only after confirming stable kidney function with tests like serum creatinine or estimated glomerular filtration rate. Let's wrap up with question number 30. Which tests your ability to recognize lab values that signal potential danger in a client taking a commonly prescribed anti-diabetic medication. The nurse is reviewing laboratory results for a client receiving metformin for the management of type 2 diabetes mellitus. Which of the following findings requires immediate notification to the healthcare provider? Let's consider the options. Option A, estimated glomerular filtration rate of 38 milliliters per minute per 1.73 square meters. Option B, hemoglobin A1C of 6.5%. Option C, fasting blood glucose of 110 milligrams per deciliter. Option D, serum potassium of 4.2 milliequivalents per liter. Now think about which value indicates a potential complication that could arise specifically from metformin therapy. The correct answer is option A, estimated glomerular filtration rate of 38 milliliters per minute per 1.73 square meters. Metformin is primarily excreted by the kidneys, and when kidney function declines, as indicated by a lower estimated glomerular filtration rate, the risk of lactic acidosis increases significantly. An estimated glomerular filtration rate below 45 requires careful reassessment of the dose, and below 30, the medication is typically discontinued altogether. In this case, the nurse must notify the healthcare provider immediately to avoid serious, potentially life-threatening metabolic complications.